Honorable Minister of Youth Affairs and Civic Education, the representative of the Honorable Minister of Basic Education, the representative of the Honorable Minister of Social Affairs, the representative of the Honorable Minister of Women Empowerment and the Family, all other government representatives, dear participants from all over Cameroon, fellow young people, we are very honored to have you here. Merry Christmas and Happy New Year to you all. Thank you. We are gathered here today to continue to build a foundation on which sustainable health and well-being of adolescents and young people in Cameroon can be built. Adolescents are a populous group in Cameroon, numbering more than 4 million. Yet, their health and well-being has not been adequately taken into consideration as to enable policies, adequate financing, and holistic delivery of services such as comprehensive sexuality education and other health and well-being services for adolescents and young people. Problem, isn't it? That's the problem. This training comes right on the heels of the 1.8 million Adolescents for Change campaign, which saw the enumeration of over 55,000 responses from young people across Cameroon on what they really want for their health and well-being. Many said that they wanted access to health care, educational opportunities, money, employment, good roads, social peace. Some said they wanted iPhone, what do you say? iPhone 14. Indeed, adolescents need these goods and services to be able to survive, thrive, and be able to transform. Je te parlais tout à l'heure que cette douce routine est le produit d'un engagement significatif ou engagement effectif ou participation effective de longue date entre les jeunes et les autres parties prenantes comme les autorités gouvernementales et aussi les agences de développement. Ok? On va savoir ce qui est engagement participatif, engagement effectif ou participation effective ou engagement significatif et aussi la santé et bien-être des adolescents. Qu'est-ce qui est la santé et bien-être des adolescents? Okay. So by the end of this session, you will be able to comprehend what adolescence means, understand the various domains. This is a very new concept, so please, it's good that we carry it forward, what adolescence really means, and the various domains and interlinkages that make up adolescent health. We also will be able to appreciate the critical issues that make up adolescent well-being they apply to adolescents and young people in Cameroon. The concept of adolescent well-being is a research paper. It's available online. So this is just a blog session. What is adolescent? The difference between adolescents, puberty, and teens. These are words we use interchangeably. What is well-being? Adolescent well-being, and the domains of adolescent well-being. To start, adolescence originates from the Latin adolescere, which means to grow up. Similar to the definition of youth, adolescence has so many concepts, including biological, psychosocial, the historical, cultural, and age-based definitions. Biologically and psychosocially, adolescence is a period of change in an individual's national growth, usually between childhood and adulthood, which involves physical changes and maturation, starting at puberty, psychological and emotional changes and expression, social and cultural expressions as well. Who can tell me, I believe some of us here are adolescents, who can tell me one of the physical changes in an adolescent? A physical change in an adolescent. Yes.
Comme changement chez les adolescents, il y a déjà la voix. Chez les filles, elle peut être plus aiguë, chez les garçons, un peu plus grave. On peut également voir l'apparition des poils pubiens et également la poussée de la poitrine chez les filles.
Merci beaucoup. Vous êtes une adolescente?
Oui.
Okay. Yeah, this still changes the growth of voice and stuff. But now, what are the emotional changes that occur as well? One emotional change.
Conflict of personality.
Personality conflict. There is a sudden dramatic way in which the adolescent wants to find himself somewhere. You know, he wants to place himself in a certain position. So he wonders a bit about what life is and where to place themselves. I believe some of us are going through it. Madam, are you going through?
No. I've passed that stage. You passed the stage. Even though some I don't do requests.
Definitely. We also have social and cultural expressions. Human beings always like to socialize. And that is what adds to our health and well-being. You can just stay without talking to someone. It's not possible, isn't it? It's a lot boring and problematic. But adolescents face this period of change in which they seek to collaborate, to build friendship, networks, and so on. It's a drastic period of involvement in this. Sometimes they make a lot of errors, but they also find themselves out. So it's a critical moment, and we must, I say with a lot of emphasis, we must take this into consideration in the growth process of individuals. Now, a lot, you looked at the various elements surrounding adolescence, but there has been much focus on the age-based definition of adolescence. And the reason is because policy has to be practical. There needs to be a certain group of people that are targeted as adolescents. So the World Health Organization will consider an adolescent to be someone between the age of 10 and 19. And the definition considers average age at which all those elements we talked about do occur. And this is at different times for different adolescents and influenced by various factors. So it's not strange to see some people beginning their adolescence at 8 years of age. And So it's different for different people. But for programming and policy, global development and global partners say that adolescents are grouped categorically in two, disaggregation. That's two segments. Those between 10 and 14 known as young adolescents, and those between 15 and 19 known as older adolescents. If you are not an adolescent, you may have adolescents at home who are sisters or children, or perhaps you might just be brought up as still going through adolescence. It's important to have this information to know how to have the process. So in connection with the above, WHO and UN in general look at young people, and we're trying to link it with youth, what youth means. They look at youth to be people between 10 and 24. Some of us might be coming here thinking we are youth, but we are not youth. According to WHO and the World Health, and the United Nations. So the UN, however, recognizes that there are different elements that surround being a young person because of contextual differences. For instance, in Cameroon, we align with the African Youth Charter, which says a young person is between 15 and 35 years. And Madame Nene will bear with me, that's the same definition in the Cameroon Youth Policy. You know, there's a Cameroon Youth Policy. How many of you know that? Vous connaissez pas du réseau des jeunes? Il y a la politique nationale du Cameroun qui définit la jeunesse entre 15 et 57. So, in this case, in Cameroon, it's somewhat policy. It's understood in strategic terms that an adolescents can actually run from 10 to 24 years. Okay, so many programs will target that, and that's why for the 1.8 billion campaign, we actually spoke about this in global meetings and decided that we will go and enumerate young people between 10 and 24 years of age. There is a difference between adolescence, puberty, and teen, of course, differences. Adolescence describes all the changes between childhood and adulthood, what we have seen biological, physical, emotional, social, cultural. Puberty is mainly a biological concept, and it describes a period of time when the body of the child starts manifesting these changes that we see. A teen is basically an age-based description of adolescents who are in their 10s, or you would say in their 10 years, like 13, 12, and so on. These are teens. I wonder what these terms are called in French. I really don't know. Didier, can you help me? How do you call teen in French? Okay. So what is well-being then? Stories of global well-being and grouped under subjective. Subjective means people value what well-being is from their own, personal thinking. What is well-being? And objectives. We looked at things that are not pertain differently to people. So, in the subjective view, people have looked at well-being in terms of, are you satisfied with your life? Are you sad? Are you hungry? Are you feeling well? Are you finding meaning in life? You know, these are questions we need to ask ourselves, whether you're finding meaning in life and stuff like that. They all come towards well-being, and it's important. You see what adolescents go through. You will come to realize that a lot of us go through this without knowing. We think that we are not adolescents. But at the end of this training, I hope that we will really appreciate what adolescents go through and the help that they need. Objective view sees material resources. I did a research around this, and we are told that material resources link more to what we call standard of living. They look at basically tangible things like access to water, food, cars, the TV set. So someone would say, well, if you have a car or a TV, if you have a higher standard of living, it's also debatable. But we also have the social welfare, like access to health, education, and associations being able to network with people, you know, determine well-being. According to an author said, objective well-being can be classified into capabilities and functions. The first one, capabilities, involves socioeconomic, physical, cultural opportunities around the person that will help him to function. You need water, you need soil, you need money, don't you? When the minister visited our stand during the CFA, he was very awe-inspired by the fact that young people were asking for money. And there has actually been that debate whether money is something that can contribute to young person's well-being. To me, I say yes. We cannot underestimate the importance of income. And many adolescents in Cameroon are really poor. And poverty is what? What is poverty? It's a disease. Oh, well. Okay. Functionings are states to be achieved, aided by those capabilities like being educated, being healthy, being informed, being confident.
S'il vous plaît, si je me réfère à ce que vous avez, ce que j'ai lu là-bas, d'accord, dit que du point de vue subjectif, le bien-être des adolescents voient le bien-être comme en fait tout ce qui entre dans le mental, la satisfaction, le bien-être intérieur.
Il fera progresser l'agenda du bien-être des adolescents. Nous resterons en contact. We are very happy at the passion you have shown. It tells us that there are many people interested in progress and development, starting with adolescents, young people. Some of us here I know very well, and you have shown us great passion. I just wish to say that we will continue in this network. We are taking your contacts. Please make sure you included all of your details here, because we still have the toolkit to further say these are just samples today. And part of the evaluation was also to obtain your feedback regarding the sample you will have to take to the stakeholders involved in production, so that by the time the copies are out, they are suitable for use. But you will have the sort of extraordinary the digital version sent to you through the details you've shared. And we will follow up very keenly appreciate and you are interacting and engaging with the document. Au nom de Dissemination et nos partenaires, nous vous remercions chaleureusement votre participation. The very next stage is going to be that dissemination, as I said. And let me tell you that this is, as I read during my introduction, my welcome, it is the foundation. So there are prospects for us to further engage. Remember, this is the second training on adolescent health and well-being. There was the first one. So we have taken note of all your comments, and we accept the fact that we are very valuable. Am I right? Is it valuable? We are very valuable. We are sorry for whatever inconveniences we have caused, but we are equally grateful at the positive impact that we've had. Please, just remain positive. There's something I'm forgetting. Okay, just remain positive. Okay, I wanted to say that as you all are, and as my sister mentioned, I am not only amazed, I am flabbergasted at the conduct of the government in this session. And you see, that is the importance of meaningful engagement. We work hand in glove. And within the government, there are people whose efforts we have overemphasized. I know Madame Eneme Chantal personally, and we have worked for so long on this document and our engagement. She is so exemplary in her dealings with the youth, the Ministry of Youth, with young people, on behalf of the Ministry of Youth. She flies the flag high, the flag of that ministry. We are very, very pleased, Madam, at your passion and continuous support. Madame Eneme was present during the first training, and she is equally present. During the first training, she stayed the entire course of the training. During the second training, she stayed the entire course of the training. We are very happy, and I know she will write an elaborate report to the minister, whom we will engage. Please, Madame Eneme, carry our immense thanks to the minister. Tell him that we continue to appreciate what he has done with us. The various meetings we've had with the minister, and the signature that he is offering the foreword, which is in a way endorsing the student. This toolkit, therefore, is qualified to be called a policy document, because the government has obtained an endorsement. We are very happy. We are also happy at the passion and support of mighty stakeholders in adolescent well-being as Open Dreams. This organization is so exemplary that I will encourage each and every one of you to connect with the country director and with any other stakeholder involved with Open Dreams. A lot of you are pursuing educational goals and objectives. Please do connect. Open Dreams is an organization I am equally a member, and I contribute so passionately. The country director I happen to know very, very well. We have a long-standing relationship for more than 10 years. The director was my teacher in Form 3 and Form 4. He taught me physics, and I noted his exemplary style from the word go. He engages and follows up. His heart is large with passion for sustainable development. I'm talking of Mr. Akawa James. So we are very happy. You see, he came and left, but came back to ensure that this moment is very significant. I told you that the best is always reserved for the last. Those who were in the marriage feast of Cana, those who hurried to leave the wedding, did not taste of Jesus' sweet wine that he made at the end. But here we are. We are the fortunate few. So, we are very happy at his presence. I remember the very first seminar that I participated in college. That was in 2014. Mr. Akawa was a speaker. He came and empowered participants. And we have continued with that same spirit. And in the first training for Adolescent Health and Well-being, he was equally present. You see how he was surrounded by passionate, dedicated people. They are our elders, we can say. So it is almost unconditional that we must allow them to say something significant to us at the close of this session, to inspire us further and to push us ahead in this whole development and progress course that we take. So, thank you very much, and I will leave the floor to Mr. Akawa to say a word.
Our hearts are deeply entrenched in the evolution of this country. In fact, attending this session today, there's so much I've learned. Just throwing my eyes on this map, I see a lot of scientific projections. You know, when I look at education and see how much science occupies here, I know the bigger the science, the more respondents I got it. I'm also looking forward to see that this school is out here and understanding that 55,000 people responded to this survey. That is something very magnificent. In fact, I've gone through this a whole lot of times. There are books that sometimes I pick and I browse through a few things, and I'm not motivated to read. But when I look at how indigenous this country is, and the number of references, I know not everybody has this. A hefty 306. That tells you how much this literature it is. I'm happy to have been part of this journey. As Desmond said, in fact, I often prefer to call him Dr. Desmond. I know that he's still about finalizing his PhD program, but the work that is pioneering. The relevance of that work, how useful it is to be here since morning to this moment because of this work. That people defend PhD for one class and you take the time and pack it up somewhere and that's it, right? But this is like, I mean, different things. As he said, a manual, as you use other words. Know you buy your phone or your computer, at times you need to turn over and see, how do I handle this? And this is what really makes us so proud. They said, for you to be able to try and know something, make the most of the opportunity you have as a person. Your well-being must be like optimal. You must know how to manage everything so that your productivity can be high. When I talk in that direction, sometimes I feel like shedding tears when I look at page 24. I'll just talk about page 24, and I see here explained top 5 causes of adolescent death. You look here, you see Africa, low and middle income countries. It is quite high. Yes, it is. This is how vulnerable an African youth is. So people tend to die here actually in young ages. And that's why I say Africa is a young continent. Because the conditions of the continent, the way we build it, they are a little bit harsh in a way that not many people survive above some age. So what do we do to change that? And so I identify a powerful cause that is that you have dedicated your life to making a difference. I mean, what could be better? How many of us here have attended sessions on adolescent well-being, adolescent health, and all of that? How many of us here? In fact, I think most of us have been in school for like 4 years and above. And we are learning about fishing in Norway, right? Why sometimes the most essential things that we need to understand? We are leaving them out. I'm happy that this book fills up those gaps. The policy government. But when I picked it and I looked at it and I saw that the minister prefaced it. How many books do you pick and see the preface by a minister? This can be clap for this one. There was a UN news station I attended online, and this one happened to have been one of the speakers. And before he was a speaker here, the UN was presenting a flyer talking about their speakers. And one of the statements, and then this one made was that if the system or the government doesn't engage you because you're young, what do? Engage them with your creativity, engage them with your ideas. Be productive in the way, be innovative in the way that we will come and ask you, how do you do this? How can you work? And we see it happening. Let me see it happening, and with that, I'm supposed to have to see. In fact, I sat with her here. We've had conversations about conversations, and I see the way she is taking notes. And when she takes notes, I don't see her taking those notes for herself. She's taking notes for the well-being of the young people around here, for the well-being of everybody, for the well-being of the world. If you do that fine, it's fine, right? You got a cook and this thing go on the streets. Who are they? See, how the youth. Yeah, so handling the individual and the welfare is secure. That is very important. And like Desmond said, people have less. I just felt like we need to give like 2,000 people together. Make good use of the media, social media, to review the TV, to propagate this message. In fact, the last presentation from Mr. DJ, he talked about blogs. He talks about the communication, one is this advocacy. Today is about advocacy, right? Yeah, so we have a total of 2,000 each. That means the person who has spread it to this group. Because we want this message amplified. We want this message to go further. And then quickly too, I saw like the dynamic among you. Accidents being the number 1 cause. I've never known this before Tuesday. I've always thought of other things like when you hear medical doctors are dead, they say the number 1 killer is the talk of malaria, they will talk about this statistics that tell us about accidents, recklessness. And people tend to be reckless when they don't think about being the well-being of our kids. I studied engineering for 3 years, but I never learned how to really handle this very well. I have to do some courses online in acting, going to the national education, and I have to teach my American children. So because that they have to prepare us against all of these things. And it was only then that I learned how to handle some of these things. Because right now we have such something in our hands, contextualized to a local situation. It's amazing. In fact, I wouldn't end by saying that I'm so touched. You know, when you were all speaking, I just need to know how much people lost with me, and I believe that we are champion. Let's multiply our championship, and like we told that we have in Africa, a world can lead, right? In this aspect. Thank you so much.
I'm doing this about volunteers. I am a volunteer. It's not a speech making something. I'm somebody who doesn't talk a lot. Desmond deserves, I just say, wow. And youth, the initiative is quite a loud one. So I told people in the beginning, this is what we want. Because with your initiative, I think you will see how sponsors will come in behind you. That is all we want. It's not all about money. Let's not say, what has the government done for us? What have you done for yourself? People should go out there and read the news as you are doing it now. So I don't think we have more, I don't have much to say. Just that the ministerial doors are open. And as I told people, it's not like that about ministry to ministry. Because I've been working with people. I'm with one of you. When I was in youth, nobody had I did not have an opportunity for somebody to drill me, to talk to me. And I do really appreciate it, especially Jews from the Northwest, because I've noticed that our brethren from the Northwest have they start from the very youthful age. Yes, that is something that we lack, even in the Southwest region. I'm from the Southwest region. I'm mostly here. If you go to the Northwest, they are quite different from the other regions of the country. I think what is funny is the Southwest. So I do really appreciate the issue, because last one time I went to the West region to train youth from the Northwest. The training was about youth, but fortunately, I was training children on comprehensive sexuality education. So when I went there, I saw the age gap. I was asking myself, what can I tell these children? Because is this something you have to talk to them about? But when I started the session and I asked them some few questions, what do you know about sex education? Sincerely, I was like dumbfounded. The youngest child, I think the oldest was 14 years, the youngest was 7. What this small girl would amount to tell me, I was like, so you see, there is nothing to hide. It is an illness that is eating us up. As I told people, our parents are old school. We are the ones to teach them. It is not a battle, it is a dialogue. And through you people, you are the agent of change. You are the agent of change. Be patient. You have a lot of loopholes. You have a lot of stuff being thrown. Even your own parents, even from your own parents. But you let no effort. I think there's no best place to tell people the hindrances that we have. But for once, there's one that we like. There's one that we don't have anybody in the office. At times when it's me, they will say, there's one that go. But never has Desmond ever lent his efforts. Today, he has come up with his toolkit, which is very, very influential. So I would lead all of us, as thank God he said, it will be sent into an email process. Take your time, read it, because through this toolkit, they are going to impact one of you. There are a lot of people suffering outside. There are a lot of people need information. We inject alone cannot meet. We are people, we are officers, we sit in our offices. It's just that some of us who do like practical work, field work. But we go outside and open our eyes and discover that a lot of people have problems and they need somebody to talk to. And what I have learned today is that mental health. Most of us are suffering psychologically. Most of us are not voicing out our problems. It's not that we have, all of us we have problems. But I just don't know what we have like problems. Just by opening up, it's already a therapy. And please, we know the society has become so bad and ill that most of us are angry when our neighbor's children succeed. Most of us are angry when we see other people smiling. Let's not be an agent of destruction. Let's be happy when others are happy. Today I'm happy because Dissemination is appreciating me. I don't need finance, but just that fact that they are appreciating me gives me joy. At least if Dissemination is making it or saying it was there. I remember the very first training, I was in the US. He talked to us through video call, and I was so
We are having the second national training on adolescent health and well-being, bringing together young people from across Cameroon, government stakeholders, development partners to this training. Something was unique about this training because we are launching the dissemination of the toolkit, the health and well-being of adolescents and young people in Cameroon. It is an effort of multi-stakeholder engagement, including government officials, development partners, young people, adolescents, to promote the health and well-being of adolescents. The toolkit compiles policies, compiles actions that promote meaningful youth engagement, and exercises that will empower young people to take up action on the ground to promote the health and well-being of adolescents. It also contains information and insights on how to promote meaningful youth engagement, that meaningful engagement of all stakeholders involved in the issue of adolescent health and well-being. We appreciate the collaboration of all stakeholders who've come on board. Just to say this, training is coming on the heels of the 1.8 billion campaign, which culminated in the Global Forum for Adolescents and the Cameroon Forum for Adolescents. 1.8 billion young people for change campaign actually helps us to mobilize over 55,000 responses in Cameroon from young people between 10 and 24 years on what they want for their health and well-being. Many of them expressed needs around education, healthcare, peace, development, and we are happy to summarize this before government stakeholders, before other stakeholders, for joint action to promote the health and well-being of adolescents in Cameroon. And we've also presented a strong case of evidence from an economic perspective, social perspective, on the importance of investing in policies, in actions, service delivery, and financing for the health and well-being of adolescents in Cameroon. Nous avons la deuxième formation nationale sur la santé et le bien-être des adolescents au Cameroun. C'est très unique parce que le lancement de la trousse à outils pour faciliter l'engagement effectif des parties prenantes qui sont les jeunes et les décideurs. Cette trousse contient des politiques, exemples des actions de participation effective des parties prenantes, y compris des jeunes, dans des programmes pour améliorer la situation des adolescents et des jeunes au Cameroun. Nous voyons que quand les décideurs utilisent cette trousse, ça peut faciliter l'engagement effectif des parties prenantes. Et avec le chapitre de la trousse, c'est important de collaborer ensemble pour augmenter le financement, pour augmenter des services et aussi des politiques pour la santé et bien-être des adolescents au Cameroun.
Bonjour à tous, je m'appelle Belle Samewendi Rina et j'ai participé au programme Dissemination. Dans ce programme, on nous a détaillé de nombreuses trousses à outils qui pourront aider les jeunes à pouvoir facilement faire des plaidoyers, pouvoir se battre pour leur santé et leur bien-être mental. Bon, dans cette trousse à outils, nous avons déjà appris les différentes lois politiques qui accompagnent les jeunes pour leur bien-être et leur santé mentale, qui sont nationales et internationales. Donc, pour permettre aux jeunes de pouvoir facilement défendre un plaidoyer, il faut déjà qu'ils connaissent ces lois que nous avons appris ici. Aussi, l'orientation conseil. Les jeunes devraient plus se rapprocher des conseillers d'orientation et même des adultes pour pouvoir facilement, avoir une meilleure approche professionnelle, pour avoir un meilleur bien-être professionnel futur dans leur vie. Et également, les jeunes devraient pouvoir se rassembler en petits groupes pour pouvoir facilement résoudre les problèmes de leur petite localité. Et pour cela, ils devraient, comme toujours, se rapprocher des adultes et bien sûr se rapprocher d'un conseiller d'orientation et peut-être même les dirigeants des organisations. Alors moi, ce que j'ai retenu dans ce programme, c'est que vraiment, nous aurons toujours la possibilité de changer les choses. Si nous voulons réellement conduire un plaidoyer, non seulement nous devons être éduqués sur la question du litige, mais en plus, nous devons être sûrs de pouvoir nous battre jusqu'au bout pour notre problème réellement. Donc, merci à tous pour cette belle écoute et voilà.
Hello, everyone. My name is Civic. I'm a member of Dissemination, specifically the IT officer. So presently, we've been doing a lot of work concerning the toolkit about the well-being for adolescents, and my experience in participating as one of the people who worked towards disseminating this toolkit was that in the process of working with people, inviting the people to come and all of that, it was quite tedious, but what is more pleasant about it is that it was adding to that was very fulfilling, and you could see the smile on the faces of people when they get to discover about some few things about their their well-being, and the various solutions that have been brought for them, through this toolkit for their well-being. Yes. So presently, actually, what actually I look forward to, doing after this event, after this training, is that we hope to get as many more people who will go out there and disseminate this toolkit and come back, with the solutions to the toolkit, and how we can even help them, to grow further and to do bigger things with this toolkit. Why not?
Thank you very much. I am Kemcha Martin Tiku, founder and national coordinator of Ruboga organization. I want to say thank you very much to Dissemination for this wonderful workshop that we had today on adolescent health and well-being. And I must confess that it was so interesting because the caliber of youth from different organizations that they brought here today, and the networking was so enriching. And one particular thing I learned was about the effective roadmap for a good advocacy. That's an additional stuff that is going to help a lot of youth that were here today, including myself. And as for the toolkit that the Dissemination has prepared, you see, with the statistics they have here, after having interviewed 55,000 people, they came out with a tool, so magnificent tool that I think if we should sit and read it effectively, it's going to go a long way to help our organizations, and we shall spread the word to the youth in the community so that together we fight and have a good health for adolescents in Cameroon. Thank you very much.
The country director of Open Dream. I am very happy with this finished product. Work of research that has taken so much time together, a lot of in-depth analysis, a lot of realities, exposed that can help our youth to blossom. And I see it really going very far. The right policy actions are taking it, everybody is engaged.
I am Madame Chantal Bole from the Ministry of Youth Affairs and Civic Education. Service for leaders of youth organization, Department of Community Life and Youth Participation. Actually, the ministry is really pleased and want to applaud the effort of Dissemination for this initiative. The health and well-being of Cameroon has always been a priority of Congress. It will be there to sensitize your peers And for this great initiative, it's really something to take back home. So we were really honored to be invited to be part of it. And sincerely, I've learned a lot, especially about the even dream. The initiative was quite laudable, and as I write close to the ministry the ministry is there for you. While you guys are ambassadors in the fields, you are a mouthpiece to your peers, the ministry is there. Take the time. So and I'm so proud of this initiative. End result is toolkit, which is going to make a lot of impact to the youth. Thank you so much for this. All what I wish to people is to continue with this. Thank you so much.
I'm called Didi Masusu. I'm a community officer in charge of mental health at Deserve. I'm equally a mental advocate. It has been an amazing day today here at the Toolkit of Polytech. This work, which has been finally materialized as this, has been ongoing since 2017. We have had several meetings, several interesting engagement meetings with officials, with the Ministry of Secondary Education, Ministry of Youth and Civic Education, who faced this fantastic work. So I'm particularly very excited because being a mental professional, this work is comprehensive, meaning that it entails, it contains elements with respect to youth mental health. And this is really important because youth mental health is becoming a public health issue in Cameroon, and young people need to know about it. So this book can enable every young person to know how to advocate for their physical health and their mental health. It's something which is going to change the way a young person sees their health, because when you are engaged in trying to advocate for something which is of social cause, it also contributes in improving yourself. And I'm encouraging every young person to have a copy, to request their school to have a copy, be it digital or hard copy, because it's going to go a long way to improve the health standards of young people in general, and young people in communities, in schools, everywhere. Advocating for change is an important thing to be done, because if young people themselves are not involved meaningfully into their health or into the things which relate to their health and their well-being, it might be very difficult for things to move to the point where it has to move. That is where young people in Cameroon, everyone in Cameroon, to receive or have the healthcare services which are suited to them, because every young person deserves the healthcare services, the mental care services which they need. And this book, if it's used, is going to contribute into that. So I'm very happy that finally this book is out.